There are little health clinics called community centers all over the region that provide, while not everything a hospital does, at least some doctors' and nurses' attention closer to home. They're critical, especially for underserved populations, but they're struggling to stay afloat because of the way they make their money. That's today's story of the day.
Support for Story of the Day comes from Pearsall Wealth Management at UBS Wealth Management USA, subsidiary UBS AG, member FINRA SIPC, 1 Broad Street Plaza, Glens Falls. And the New York State Caregiving and Respite Coalition, seeking volunteers aged 55 plus to support family caregivers in northern and central New York. Visit nyscrc/AmeriCorps.org.
Hey, I'm David Summerstein. It's Monday, January 20th. First up, Donald Trump was sworn in today as the 47th president of the United States. He overcame impeachments, criminal indictments, and a pair of assassination attempts to win a second term in the White House. In his inauguration speech, Trump laid out an ambitious and very partisan agenda. He promised to end America's, quote, decline, establish a, quote, golden age, and, quote, completely and totally reverse the actions of former President Joe Biden, who drove him from office 4 years ago. You can hear complete coverage of the speech and analysis on NPR and on our website at ncpr.org. Today was also, of course, Martin Luther King Jr. Day. Laura Harding, president of the Long Island-based advocacy group Erase Racism, says to honor King's legacy, read more of his work beyond the famous I Have a Dream speech.
Don't let anyone interpret for you what he meant or what he said, so that you can be inspired to make sure that in your day-to-day, you are being a moral person who is working hard to heal yourself from the ills of racism and also working to end the way that structural racism is perpetuated in all of our systems.
Harding says institutional racism still exists, especially in the housing market and in the school system. She recommends King's 1967 speech, Beyond Vietnam, and his book, Where Do We Go From Here? Chaos or Community. Forest rangers rescued a moose last week that fell through the ice in the central Adirondacks. The rescue took hours and some creativity, but the moose eventually made it safely to shore. Emily Russell has the details.
It happened last Thursday. Environmental Conservation Officer Robert Higgins got a call from the DEC. A moose had fallen through the ice on Lake Abenaki in the town of Indian Lake.
There was a civilian there who saw it actually walking out on the lake and saw it go through at about 11 o'clock in the morning.
Higgins, another ECO, and a few forest rangers suited up in their ice rescue gear. They walked out on the frozen lake towards the moose, testing the ice thickness as they went. The plan was to cut a path through the ice from the moose to the shore. Here's Ranger Matt Severy.
The moose was probably 100 yards from shore, and the ice varied from 4 to 1 inch. So it made cutting it with a chainsaw pretty quick. And the ice it wasn't really black ice, so it was pretty soft to begin with. So we were able to cut a path out there pretty quickly.
But even once they cut a path through the ice, Severy said the moose was reluctant to follow it to shore.
We tried poking it with a couple different things, but it didn't seem afraid of them. So finally we pushed the jet sleds that we had up close to it.
Jet sleds are those long plastic sleds that snowmobilers sometimes drag behind them with extra gear.
And for whatever reason, it was scared of those. So once we got behind it, we were able to direct it to the path, and it actually swam out pretty quick to shore.
The whole rescue took about 2 hours. Officer Robert Higgins, who was one of the first on the scene, said watching the moose finally walk up on shore was amazing. He said the massive animal was shivering and looked exhausted.
You know, every minute counts when something's in that cold water. So the quicker you can get that animal or person out of the ice, the better chance you have for survival. So it was great to see everybody just get into action and get going.
It took the moose about 15 minutes to regain its strength on shore before it walked away into some nearby woods. The incident serves as a good reminder that a lot of the ice across the North Country is still unstable and unsafe. Emily Russell, North Country Public Radio.
There are over 800 community health center clinics across New York State. Their mission is to provide health care in underserved areas. In the North Country, there are around 30, run by organizations like the Community Health Center of the North Country and Hudson Headwaters Health Network. But those health centers have been struggling to stay afloat financially in recent years. Amy Feiereisel reports.
Lots of North Country residents see doctors at community health centers for their primary, preventative, and oral care. Those health centers are often the only option for folks on Medicaid, and in some places, the only health care in town, literally.
Many times, we are the lifeline in communities that have no other option.
Pamela Fisher is a spokesperson for the Hudson Headwaters Health Network. It operates community health centers in 7 upstate counties, including locations in small communities like Indian Lake, Mariah, and Champlain. Hudson Headwaters is one of the main providers of care in the eastern Adirondacks. Fisher says they're committed to that care no matter the economic landscape.
But that doesn't mean that we're not navigating significant challenges and uncertainties.
At many community health centers, those challenges are translating into fewer hours, less staff. One of the big issues in the North Country are aging doctors.
Physicians in upstate New York continue to age, and we really don't see a lot of younger physicians coming in.
That's Rose Duhan, the CEO of the Community Health Center Association of New York State. She says as those older doctors retire and close their private practices, their patients have to go somewhere.
The health centers are picking up those patients.
That's putting more demand on community health centers that are already struggling to hire enough staff. That takes us to the root of the problem. It's hard to hire doctors when you can't pay them enough. You see, 2/3 of the patients that health centers see are on Medicaid. But health center Medicaid rates were set in 2001, using costs from 1999.
Meanwhile, obviously, costs and inflation have not stayed the same since 1999. So health centers are seeing a huge gap in what it costs to deliver care to a patient compared to what they are paid by Medicaid.
Now, Medicaid reimbursement might sound like a bunch of red tape, but Duhan says this ever-widening gap is having real impacts on care, especially in the last few years.
Since the pandemic, workforce costs have skyrocketed, and bigger healthcare systems are able to pay better. That puts more and more pressure. So health centers are really feeling that pain right now in terms of being able to recruit and retain providers.
So even as more patients need community health centers, Duhan says locations are having to reduce their hours, even lay off staff. She says many health centers have 6-month wait times for dental care, which is particularly scarce in rural areas.
I mean, in places like the North Country, if you're somebody who is covered by Medicaid as your insurance, private dentists won't see you.
It's important to note that these centers do a lot of community work that isn't reimbursed by Medicaid at all. Ray Babowitz is a director at the Community Health Center of the North Country, which operates 4 sites in Canton, Gouverneur, Ogdensburg, and Malone. He pointed to their work tackling loneliness in the elderly and a new project to put telehealth equipment in seniors' homes.
The reason I bring it up is because these aren't reimbursable programs.
What makes those special programs possible is the Medicaid reimbursement for their standard services, which Babowitz says is too low.
And if our proper reimbursement falls away or continues to be eroded, as we're seeing, programs like that are going to be the first to be cut. And the people that are being isolated the most already are the ones that are going to be hurt the most.
This is why the Community Health Center Association of New York State has been pushing the state to evaluate and update those 1999 reimbursement rates. Rose Duhan says the group introduced legislation last year and lobbied hard for Governor Hochul to include a bump in rates in her recent State of the State address. But there was no mention of primary care or health center rates in her speech or policy book.
I mean, we're disappointed. We would like to have had that recognition of how important primary care is, of how health centers are really essential, again, as the governor's talking about affordability.
Duhan says they're still pressing for rate reform to be included in the upcoming governor's budget. She says the whole healthcare system is weakened when health centers can't operate sustainably.
Health centers they're just a critical foundation for the healthcare system. And if that foundation isn't strong, that has ripple effects throughout the whole system.
When people don't see a doctor regularly or get a cavity pulled in time, she says small issues become big, life-threatening ones. And hospitals and emergency rooms are already struggling to keep up. Amy Feiereisel, North Country Public Radio.
We have more news all the time on our website, ncpr.org. Music today by Christopher Watts and Danny Thomas, both of Canton. I'm David Summerstein, North Country Public Radio.